are looking at the glucose transporters. So here there is the SGLT group as well as the GLUT. So we are going to look at each one of them. So in case of SGLT1, it is found in the intestine as well as the proximal tubule. So next one is the SGLT2. So here this is found mainly in the proximal tubules. So an important point being, they help in the absorption of the glucose and it is unidirectional, as well as there is the sodium glucose symport and the secondary active transport. Then moving on to the GLUT1. So in GLUT1, it involves the brain, the kidney, the placenta, the colon, as well as the RBC and the retina. And it is widely located and there's high affinity for glucose. Next, looking at the GLUT2. So GLUT2 is in cells, that is the sinusoidal cells. This is present in the liver. Then also the beta cells in the pancreas as well as the intestine, that is the serosal side, as well as the kidney. Other thing to note is that there is the absorption of the glucose and there is low affinity and high Km. Then we are looking at the GLUT3. GLUT3 is in the neurons, the placenta, as well as the kidney, and it has a very high affinity. Next, moving on to the GLUT4. GLUT4 is seen in the heart. Heart has 4 chambers, so it's easy to remember. Then the skeletal muscles as well as the adipose tissues. And other thing to note is that it is insulin dependent GLUT. Then moving on to 5, GLUT5, it is present in the testis as well as the intestine. And it helps in the absorption of the fructose. Then there is 6, GLUT6 is present in the spleen and the leukocytes. Here there is no transporter function. Then we look at 7. 7 is present in the liver as well as the smooth endoplasmic reticulum, and it helps in the absorption of the glucose. Then 8, it looks like B, so it is a blastocyst. And next comes 9. 9 is the intestine as well as the kidney. And what important is that it helps in the urate transport as well as in the mutation, a primary gout.